Hi there, this is Dr. Laura Jones, and today I'm going to talk to you about menopause and micronutrients. These are two subjects that come up often in my office and certainly worthy of diving into in detail. So, is there a way to test my nutrient levels? My patients commonly ask this question, which is valid considering approximately 1/3 of the US population is at risk for at least one vitamin deficiency. For many Americans, the food on their plates exceeds caloric needs by far, yet unfortunately falls short of meeting the body's micronutrient demands. This results in nutrient insufficiency and vulnerability to various nutrient-dependent health concerns. Many patients don't realize, though, when they're asking that question, can you test my nutrient levels, that serum nutrient testing through conventional laboratories has significant limitations. However, there is a solution for reliable testing through dependable labs that I will share with you in this video. I'll also explore various benefits of micronutrient assessment, how I use it in my functional medicine practice, and the challenges and considerations when ordering patient testing in this fashion. In particular, this video will apply knowledge of micronutrients to women in menopause. So in addition to a review of the micronutrients, we're also going to talk about micronutrient testing and menopause. This video pulls it all together to explore the roles of crucial vitamins and minerals in women's health and how the demand for these micronutrients changes as a woman ages. We will review how to employ micronutrients to reduce challenging symptoms associated with menopause, improve quality of life, and reduce the risk of chronic disease. So let's dive in. Let's start with micronutrients. The term micronutrients refers to a vitamin or a mineral that the body employs in energy production and fueling our daily metabolism. Micronutrients are required in pretty small quantities, but absolutely necessary for our biochemistry to run optimally. Essential micronutrients are a group of nearly 30 vitamins and minerals that the body cannot produce adequately on its own. So they have to be derived from dietary or supplement sources and are involved in a wide array of functions throughout the body to support average growth, development, and health maintenance. Due to the substantial food supply available to most Americans, vitamin and mineral deficiency is much less common now than it was in the past. However, consuming less than ideal amounts of critical vitamins and minerals favors nutrient insufficiency. And what we're seeing then is development of several health concerns and significant illnesses related to nutrient insufficiency. This includes type 2 diabetes, heart disease, osteoporosis, cancer. These are just a few. So for example, suboptimal D3 levels are correlated with bone loss, a decline in immune function, poor mood. Suboptimal vitamin E is associated with a higher cardiovascular risk, and less than ideal B vitamins, which we actually see often in my practice, are correlated with higher rates of heart disease, neuropathies, chronic fatigue, even anxiety and depression. An important concept that is really important to get through to you is that a plentiful micronutrient supply within the bloodstream does not equate to an ample supply within our cells. For many of our micronutrients to enter into our cells to participate in our important biochemistry, they must pass through proteins embedded in the cell membrane called carrier proteins or transmembrane transporters. In the presence of normal extracellular levels of micronutrients, intracellular concentrations of various nutrients depend on several factors, including the ease of transport across the cell membrane, availability of required cofactors for transport, and even systemic inflammation in the individual. This can all lead to malabsorption of the micronutrients into the cells. So if serum levels are on the lower end of the normal reference range, there's a more substantial likelihood then that the patient will have deficiency within the cell. So let's think about it this way. Imagine having a well in your yard with thirst-quenching crystal clear drinking water. But the pipes of the house may be malfunctioning because you turn the faucet on and just a few tiny drops of water drip into your glass. Your cells are like that house. Despite plenty of water in the well, there's no guarantee you'll get it into your glass. If nutrients do not make it into the cell, critical biochemistry cannot occur. So micronutrient assessment is blood testing that measures a patient's nutritional status by measuring the levels of the vitamins, minerals, and other essential nutrients. And lots of patients ask for this for very good reason. They want to understand more about what their nutrient status is and what they can do to correct it. This type of testing certainly is valid then, and a really helpful tool when working with patients to uncover the cause of their health concerns and also to allow them to achieve optimal health, making our treatment plans successful. However, most providers measure micronutrients in the serum. So they employ serum testing, and as mentioned above, this really does have significant limitations. Serum testing measures extracellular micronutrients located in the plasma portion of the blood. And while this can be valuable in detecting true grave deficiency of nutrients, circulating levels are actually poor indicators of the body's nutrient status. Measuring nutrient levels outside of the cell actually tells us very little about what's happening intracellularly, where micronutrients do most of their work. A more dependable and beneficial way to investigate micronutrient status is actually the intracellular testing. Labs that employ intracellular micronutrient testing measure nutrients inside the blood cells rather than the serum. Critical biochemistry occurs inside our cells, making intracellular testing a significantly more helpful tool than serum when we're assessing our patient's nutrition status, and really helpful in employing the results to create an effective treatment plan to cater to their health concerns. In addition to serum nutrient testing and intracellular micronutrient testing, some labs also employ methods to assess for functional micronutrient deficiency. You may have heard this term before. This type of testing measures the function or performance of a nutrient within the cell rather than only measuring the amount of the micronutrient present. Functional micronutrient testing reveals if the cells and the body are using the nutrient to satisfy the biochemistry by measuring metabolites and organic acids involved in various systems, including immune function, antioxidant function, glucose-insulin interaction, and fructose metabolism. The functional micronutrient testing employs blood and urine. And the most valuable micronutrient panels that we employ here at our office combine intracellular testing with functional testing for the most comprehensive look at our patient's nutritional status. There was a study done in 2022, just an example of how important this type of testing can be. This study explored selenium status in athletes and actually revealed that the value of intracellular selenium was quite different in the athlete than the extracellular level. In fact, the intracellular level was significantly lower. Researchers attributed the difference to the inflammation and the oxidative stress caused by regular physical training, negatively impacting the selenium transport into the cells. One of our most valuable minerals, magnesium, is an important cofactor in more than 300 enzyme reactions within our cells, and it is important for energy production, protein synthesis, muscle and nerve function, you name it. Magnesium helps us regulate blood sugar and blood pressure. And magnesium is another excellent example of a micronutrient that is difficult to assess for deficiency, as most magnesium is in the cells or in the bone, but not in our serum. This results in very little correlation between serum levels of magnesium and total body or tissue magnesium status. So reputable test panels measure close to 30 essential micronutrients and functional nutrition markers and provide a very comprehensive view of what's going on in our patient's biochemistry. Let's talk about the benefits and the common applications of micronutrient testing. Micronutrient testing has proven to be an invaluable tool in my practice. Test panels that combine intracellular and functional markers of each nutrient allow me to screen for deficiencies, evaluate for prime nutrient status, and assess how patients are using micronutrients at the cellular level. Micronutrient testing is of value when I have a particularly challenging patient, if they're not responding the way I would expect. I also use micronutrient testing a lot in my athletes. I have a lot of competitive athletes, and this is a really valuable tool in aiming to support optimal performance. And even my healthiest patients, I use micronutrient testing for. This is because I want to ensure that their treatment plan remains effective. I also employ this type of testing often in my patients experiencing menopause symptoms and through the menopause transition. And this is an area I'd like to spend a lot of time talking about throughout this video today. So let's back up for just a bit and briefly review menopause before we dig in. So menopause, one of my favorite subjects to talk about, certainly a health concern that comes up often in patient visits. And, the thing about functional medicine is we have so many awesome tools in the toolbox that can help this transition be much easier for females. So menopause. Menopause is defined as the absence of menstruation for 12 successive months, and it indicates the end of ovarian function and the end of a woman's reproductive years. This transition takes place most often between the ages of 45 and 56, with a median age of 51 in the United States. Menopause is accompanied by a decline in estrogen and progesterone levels, which we all hear a lot about. And unfortunately, this decline can significantly impact a woman's health and well-being. So women come to us often with uncomfortable symptoms associated with this hormone decline. Considering that the female body actually takes 8 to 10 years to prepare for menopause, it's essential to start our review of this transition discussing perimenopause. So what is perimenopause? Perimenopause represents the time during which the female body begins to transition to menopause naturally. In some women, perimenopause can begin even in their 30s, but most often this is happening between the ages of 40 and 44. This is when it will begin. This period is marked by changes in the menstrual cycle, often including menstrual flow and the cycle length. And these changes result from a reduction in ovarian hormone production, with estrogen and progesterone levels rising and falling unevenly. From one day to the next, it seems, we can see changes in hormone levels, causing the menstrual cycle to become very unpredictable or irregular for many women. Menstrual cycles can become a challenge during this time, but this is natural and expected progression in a woman's reproductive cycle. Sometimes reminding patients of that can set them at ease as you start to approach their menopause symptoms to try to make them more comfortable. During menopause, women may also begin to experience hot flashes and vaginal dryness, the most common and often most troublesome signs of menopause. Once 12 consecutive months without a menstrual cycle have passed, a woman has officially reached menopause and the perimenopause period is over. However, without a doubt, hormone levels can still continue to shift and decline for another 10 years beyond menopause, and signs and symptoms of menopause can continue as well. You've probably heard a lot about them from your female patients in this age group, but menopause signs and symptoms include irregular periods, skipping of periods altogether, certainly shifts in menstrual flow, hot flashes and night sweats, vaginal dryness and discomfort with intercourse, changes in mood, including depression and anxiety, irritability, and mood swings. Often women will feel that they don't have control over their emotions the way that they did in the past. Another concerning sign or symptom that comes up for a lot of my patients is a decline in cognition. Women feel scatterbrained, they feel foggy-headed, and they become concerned about dementia. Urinary urgency, sleep disturbance, and weight gain are also common signs or symptoms we see. Changes in sexual function, including sexual libido, loss of bone mass, and a shift in cholesterol levels, including an increase in LDL or other cardiometabolic concerns, may come up during this time. So as I mentioned earlier, there are nearly 30 vitamins and minerals that the body cannot produce in adequate amounts on its own. These are our micronutrients, and they are derived from our diet or supplemental sources and are involved in a wide array of functions throughout the body. A woman's nutrient requirements change significantly as she enters perimenopause to support the changes in hormones and cardiovascular function and bone health, and to deal with all these symptoms and signs that I just told you about. The most essential micronutrients during menopause definitely vary between individuals. No two women are exactly alike. However, the following nutrients are of particular value, and if dietary sources are not reliable, supplementation certainly is considered. So when we are assessing micronutrients, I want to make sure to remind you we are talking about nutrients divided into two categories. We're talking about macronutrients and we're talking about micronutrients. I can't finish this video without mentioning macronutrients because they do shift and change what we need for macronutrients during the menopausal years. So I reviewed a little bit about micronutrients earlier. However, macronutrients and the shift in their demand during menopause is definitely also worth talking about. There are 3 categories of macronutrients we'll discuss: carbohydrates, protein, and fats, which are all used as fuel for a healthy body and energy production. And as a woman approaches menopause, we see that she has to be pretty mindful of her nutrition to ensure she is consuming adequate amounts of both macronutrients and micronutrients. In particular, regarding macronutrients, an increase in protein consumption is helpful in the prevention of weight gain and the prevention of muscle loss, 2 complaints that we see a lot during this time of change. This is because aging increases dietary protein requirements. Skeletal muscle reduces their protein synthesis activity in response to exercise, so a woman does not get as much of a return on the investment that she once did. In fact, studies reveal that higher protein intake is associated with leaner body mass in postmenopausal women, lowering the risk of frailty and improving physical function as they age. This is why when I'm working with a female during the menopause years, we are always working on nutrition and focusing on increasing their protein with each meal. In addition to more protein, it appears that consuming lower carbohydrates with moderate healthy fats lowers the risk of weight gain in postmenopausal women as well. Now, back to micronutrients. The most common micronutrient deficiency in menopause definitely varies between each woman, as I mentioned earlier. But let's talk about a few of the micronutrients that we find are most important to assess. Make sure patients getting plenty of the nutrition, and if not, consider supplementing with. I'd like to start with vitamin D. Vitamin D serves many roles throughout menopause, including supporting a positive mood, bone mass, cardiovascular health. It supports immune function and skeletal muscle mass. Vitamins D in preventing osteoporosis is significant. We've heard a lot about that. New bone production and calcification occur with vitamin D's support of calcium and phosphorus absorption into the small intestine. Vitamin D receptors are present in both the bone and the skeletal muscle, and vitamin D positively influences muscle function, strength, and balance, all that are so important for healthy aging. Vitamin D promotes anti-inflammatory and antioxidative stress, reducing the risk of cardiovascular and metabolic diseases. In fact, a 2021 study found that D3 was inversely associated with fasting glucose and insulin in postmenopausal women with type 2 diabetes. Very important one to make sure your patient is getting plenty of, especially up here in New Hampshire, where I live, where we really aren't able to make as much vitamin D in our skin as perhaps patients down in Florida or in San Diego, right? Vitamin D and its metabolites cast an anti-proliferative effect on tumor cells, reducing the incidence of several cancers, including lung cancer, ovarian cancer, and breast cancer. It also supports a positive mood, and this is really helpful during menopause, as women are significantly more vulnerable to depression and anxiety as estrogen levels falls. Vitamin D protects the brain's dopamine pathway in particular, and this provides an antidepressant-like effect, supporting the more positive mood. Another group of nutrients that's important to assess and definitely supplement if a patient is not getting enough is the family of B vitamins. B vitamins are essential throughout life, especially during menopause. The primary function of the B vitamins is to help the body metabolize carbs, proteins, and fats into energy. We all learned about this in med school in our biochemistry classes. Krebs cycle is a biggie, and the vitamin B family as a whole is critical as cofactors throughout Krebs cycle. ATP production cannot occur without B2, B6, B12, and folate, cofactors for enzyme activity throughout our metabolism. The B vitamins also support our nervous system. They're necessary for properly metabolizing and detoxifying our hormones, our medications, our neurotransmitters. So insufficient intake of Bs is absolutely associated with higher homocysteine levels, increasing the risk of stroke by 19 to 24%, pretty significant. And the incidence of dementia and Alzheimer's is also correlated with insufficient intake of B vitamins. Calcium is another micronutrient we learn a lot about, essential for multiple functions throughout the body, including muscle contraction, blood clotting, nerve function, bone health, especially in an aging female. Most calcium exists in the skeletal system. However, it's pulled from the bones when plasma calcium concentration is low. And since estrogen aids in maintaining strong bones, reduced estrogen during menopause leads to more bone loss. Also, net absorption of dietary calcium declines about 25% in adults and continues to decrease as we age, making calcium supplementation especially important in postmenopause. An important note is recent research the last several years reveals that supplementing calcium along with vitamins D3 and K together provides some assurance that calcium will actually make it into the bone and support bone health rather than being deposited within the blood vessels, which is not where we want it, right? Zinc is another one, such an important one to focus on. Zinc's had a lot more attention since COVID. As we know, it supports proper immune functioning, but it also is very important in the integumentary system, in our vision, and in body composition. Zinc in combination with antioxidants from a healthy diet is shown to reduce the risk of macular degeneration, so protecting our vision. As we age, zinc is crucial in supporting cognitive and emotional health, and zinc deficiency is common in postmenopausal women and correlates with a tendency to gain fat mass, as zinc is involved in several important aspects of energy metabolism. It helps in regulating leptin levels, our satiety, and body weight. And lastly, magnesium. I could talk about several other micronutrients, but I want to limit it to those that I find are most important, and magnesium certainly is on that list. In pre- and postmenopausal women, low serum magnesium correlates with low bone density. And lower magnesium levels are associated with postmenopausal women with an osteoporosis diagnosis than those without. So dietary magnesium also appears to have a preventative effect on osteoporotic fractures. Magnesium is involved in insulin sensitivity, in maintaining healthy blood pressure, and has been found to improve muscle recovery after workouts. I use this a lot with my patients. I find it actually can also lift the mood. It can aid in more restful, restorative sleep. And in my athletes, as I mentioned before, we're also finding their magnesium demands are quite high. They often test very low for their intracellular magnesium. So in addition to fortified foods such as dairy and orange juice, oily fish are probably our richest source of vitamin D in the diet. This includes salmon and mackerel and sardines. If a patient isn't eating these types of fish or foods every day, especially up here in New Hampshire, we are supplementing with vitamin D. B vitamins as a group are most predominant in animal proteins, such as poultry, meat, fish, and dairy. This makes vegetarian and vegans quite vulnerable to vitamin and folate deficiency. While dairy is a solid source of calcium, legumes, dark leafy greens, nuts, seeds, and whole grains also provide an impressive amount of calcium. So that's something to keep in mind. We don't necessarily need to eat dairy every single day in order to get our calcium. If a patient is eating a whole foods diet, they're probably getting a good amount through diet alone. And this is something you can have them track to assess where they're at and decide if supplementation is necessary. The foundational components of a Mediterranean diet, including our fish and our legumes and our fruit and veg and whole grains, nuts and seeds, really make this type of eating a rich source of micronutrients and a solid recommendation for menopausal females. The high phytonutrient content in the Mediterranean diet provides an anti-inflammatory effect, an antioxidant effect that protects us as we age. And several studies have revealed that Mediterranean-focused nutrition aids in weight control during menopause, also aids in reducing menopause symptoms, reducing the risk of cardiometabolic disease, reducing the risk of discomfort associated with menopause symptoms, and also reducing the risk of obesity as a woman ages. A study reviewing the value of the Mediterranean diet in reducing hot flashes and night sweats in particular during menopause found that there was a 20% reduction in these vasomotor symptoms in women who followed the Mediterranean diet. As a whole, the U.S. population, the adult population in particular, is deficient in several micronutrients. And if not deficient, definitely can be insufficient, meaning not enough to support the biochemistry ideally. Several factors contribute to this, including the rise in low nutrient, high calorie processed foods, the increase in sugar consumption. Don't forget that we use B vitamins and magnesium like crazy in order to metabolize sugar. The development of nutrient deficiency here in the US is also influenced by agricultural practices that deplete soil nutrients, and several deficiencies can result just from chronic disease alone. How the disease influences our biochemistry and the body's nutrient demands. However, even amid solid health and balanced nutrition, ensuring adequate micronutrient levels to support optimized biochemistry is of value, particularly in menopause. Sometimes food just is not enough. This is particularly true in my perimenopausal and menopausal patients. In fact, studies have found that employment of supplemental micronutrients helps alleviate several menopause symptoms, including hot flashes, night sweats, insomnia, depression, and fatigue. Choosing which nutrients to supplement, the actual products themselves, and the dosing can feel very overwhelming to patients. So awareness of quality and safe therapeutic dosing is absolutely essential. When a patient feels overwhelmed, I definitely say, let's work on this together, or let's get you in the hands of a provider who specializes, like me, in functional medicine, who understands the importance of high quality and absorbable nutrients, and also understands proper dosing so that they can offer a safe way that the patient can be confident in to create an effective supplement regime. One of the best ways to support the health of our patients as they age is to absolutely teach them to employ food as their primary source of medicine. So I just spoke about supplementation, but really we're always first working on nutrition. This is one of the foundational components of a functional medicine treatment plan, and certainly is of value when treating most health concerns, including menopause. A 2017 study revealed that the Mediterranean diet has significant benefits for women during the menopause years due to its cardioprotective effect. Adherence to the Mediterranean diet during menopause was positively correlated with lower levels of cholesterol, triglycerides, and inflammation marked by C-reactive protein. As I mentioned earlier, the key components of the Mediterranean diet include antioxidant-rich veggies and fruits, lean proteins such as your fish and legumes, as well as whole grain, nuts, and olive oil, and encouraging patients to employ key components of the Mediterranean diet to create their meals lends to leaner body composition throughout the menopause transition. Inspiring patients to create colorful dishes with veggies and fruits is an effective way to ensure they're getting sufficient dietary micronutrients. All those bright colors are because of all the micronutrients in the foods. By creating meals rich in protein, produce, and fiber, patients consume foods that stabilize their blood sugar, allow for better satiety, and reduce the tendency to reach for sweets later in the day. The high phytonutrient content of the Mediterranean diet, like I said, provides an anti-inflammatory and antioxidant effect. Many strategies support better compliance with a healthy nutrition plan. This can be tricky for a patient, especially one who doesn't have a lot of experience with eating a whole foods diet. The idea of changing their nutrition can feel a little overwhelming. One of the simplest things to employ is meal planning. So teaching a patient and encouraging a patient to take some time each week to map out what they will eat during the majority of their meals and create a grocery list is an effective way to improve compliance with healthy eating. I also encourage patients to prep their veggies for roasting or for salads once they arrive home from the grocery store, before they even put them away in the refrigerator. This reduces meal prep time throughout the remainder of the week. And it's important, of course, to leave some flexibility in this plan, but these simple steps can add ease to clean eating. Healthy nutrition is also about more than just the individual foods we eat. Teaching patients how to combine foods to create balanced meals to provide adequate macronutrients and micronutrients for the body to run optimally is very helpful. Encouraging women in menopause in particular to include lean protein, veggies, and fiber-rich foods in each meal is a strategy for creating strong nutrition. When these foods are combined, they create a balanced meal that not only will help stabilize their blood sugar, but also will prevent them from wanting to reach for more after the meal. So planning plenty of protein and plenty of fiber from their veggies helps with being satiated and decreases the chance of snacking, particularly after dinner. During the menopausal years, several functional foods may provide a benefit beyond their basic nutritional status. One example of this is calcium-rich foods to support strong and healthy bones. These include your dairy and your legumes, your dark leafies, and your nuts and seeds. Another functional food group are foods rich in phytoestrogens, such as soy and flax seeds, lentils, and sunflowers. These are awesome, healthy foods, but they can also reduce symptoms of hot flashes and vaginal dryness in our menopausal females. Don't forget about fermented foods such as yogurt and fermented vegetables. These provide beneficial probiotics to strengthen gut health and also protect from vaginal dysbiosis during menopause. And lastly, another functional food group I love and stress with all patients, in fact, I even give them handouts on how to roast it and make it taste great, are the brassica family of vegetables, including your broccoli and your cauliflower, your Brussels sprouts and your cabbage. These foods actually shift estrogen metabolism to reduce the risk of breast cancer. So women transitioning through menopause, certainly we need to focus on lifestyle and nutrition. This is a very rewarding way to support their health. Not only do we want to look at micronutrients and macronutrients, we also want to look at hydration. I can't tell you the number of patients that just don't think to hydrate as well as they should. And amid hot flashes and night sweats, especially as we age and we replenish fluid more slowly, we really want to make sure patients are aiming to consume half of their body weight in ounces per day as a reasonable goal for adequate hydration. Another foundational component to a healthy transition throughout menopause is a consistent exercise habit. Exercise routines through menopause and beyond should include cardiovascular exercise, weighted workouts, and stretching. This type of comprehensive exercise plan is conducive to maintaining endurance and strength, flexibility, and balance for healthy aging as well. That's all for today. I hope you have enjoyed this video on micronutrients in menopause.
Welcome to Rupa Health, the best place to order, manage, and track results from over 30 different lab companies in one single place for free. It's going to take you under 2 minutes to sign up, and you can order any functional medicine lab for your client in under 30 seconds. Let me show you how it's done. So here's our beautiful interface. I'm typing in the name of my client, selecting the lab that I want to order for them, and hitting send. From there, Rupa and their amazing team handle the rest. They email the client, collect payment, and even offer an interest-free 3-month payment plan. We've also built the world's largest library of information about chronic health conditions, the lab tests that can help you find the root cause, and the evidence-based interventions that you can use to help people heal from them. It's called the Rupa Health Magazine. There, we have in-depth articles about almost any health condition you can imagine. And we give you step-by-step protocols that other clinicians have used to help their clients heal and that are verified by evidence-based sources. You should totally check it out, and it'll transform your practice. And we can't wait to see you. So make sure you sign up today at rupahealth.com.